Hello, I am Dr. Daniel Wu. Good morning, good afternoon, and even good evening, depending on where you are in the world. I'm really honored to speak to a global audience. I thank Tom for asking me to give you a talk on the differences between the no bone cutting syndesmosis procedure and the traditional bunion surgery by breaking bones. We will also have a guest patient who had both of these surgeries to share her experiences with us. To start, I would like to review some basic knowledge in the bunion deformity condition and also its surgical treatment. After my talk, there will be a Q&A session before we interview our guest. So, slide please. So to start with, I would like to make sure that we all understand what the ligaments are and what they are for, because it will be the essence and the critical element of today's talk. So what we see here is a knee joint where there are four essential ligaments, one on each side of the knee joint, and also the two crossing each other in the knee center. If any one of these ligaments is torn, then the knee joint will be unstable in doing sports. In the foot, there are 28 bones and more than 70 ligaments holding them together so that one can walk, run, jump without the bones separating or falling apart. So the ligaments are very, very important structure to keep our bones together, body. So what has happened in our bunion feet is that the first metatarsal bone has moved out of its normal position. Of course, the question is why would it do so? That is because, again, the ligament issue. The ligaments that are supposed to support and stabilize this first metatarsal have become weak and loosened for some reasons like heredity, female hormone estrogen, or just a simple wear and tear reason. Next slide. If one needs to have the bunion condition corrected, it's actually quite simple in principle. All we need to do just reverse the pathological process, which is that if the first metatarsal has moved out its position, then we simply try to upright it. And then also, of course, we need to address the ligament issue. Otherwise, the same problem will recur in the future. So what the surgeon can do to achieve those two objectives, which are to upright the first metatarsal bone and also stabilize it. For the bone preserving or the no bone cutting syndesmosis procedure, the first metatarsal can simply be upright by tying itself to the adjacent second metatarsal. And of course, the way it will help stabilize the first metatarsal is the surgery itself will induce the fibrous tissue or simply scar tissue formation between the first and the second metatarsal to hold the first metatarsal to the second one and prevent it from moving apart again, and thus prevented the recurrence of the bunion deformity. And the bone breaking surgery also can be called cut and shift procedure. The concept behind it is that if the first metatarsal is leaned and sticking out on the side, then just break the bone into two parts and move the distal portion back into the foot so that the foot from outside would look narrower and straighter. However, there are some concerns about cut and shift procedures. One is that even though the first metatarsal has moved out its normal position, actually it itself is still normal. It has not become crooked or deformed. So that if it's normal from the ever beginning, if one break it and shift it, that would actually make the bone deform. The consequences of that is that the function of the foot, of the big toe, may not be restored. And also by breaking the bone can create some necessary risk of complications. And then also another concern about the cut and shift procedures is that they do not usually address the ligament issue. So that means that recurrence of the deformity is a problem. Has pretty much concluded what I want to say, and I'm sure you may have some questions. Please write them down and send it to us before we will interview our guests. We have one audience submitted a question in Chinese. I will first answer it in Cantonese before I will translate it to English. This question is that after the bone cutting surgery, under what circumstances may need surgery again? And usually, like I said earlier, there are some complications may be associated with the bone cutting surgery. And if the patient's still having pain or even worse pain or recurrence, then what we call the revision surgery, try to correct it, may become necessary. I'm sorry, I spoke because I said, okay, I will answer the question in Cantonese now. 係咁樣嘅，如果呢做咗截骨手術，因為截骨嘅嗰個地方咧有時會出問題嘅，就好似咧，譬如截斷之後呢，生翻嘅唔係想象中 OK 個位置咗位，或者咧係因為冇處理嗰個人體嘅問題。就有復發，普通話4、5年之後咧可能會復發咧，就又有需要咧做翻手術嚟根治佢。Okay, while we are waiting for more questions, I would like to reiterate the essence about the bunion deformity is that first of all, it is a condition of the normal bones displaced from their normal position. And the problem is not in the bones, but the ligament. Ligaments need to be corrected to not only restore the normal anatomy, but also function of the foot. And the second essence of the bunion condition is about the surgery, because the bunion condition actually uh, affect the foot function, mechanical function of walking than anything else. So the surgery, you know, it has to be proven capable of restoring function of the bunion foot. Then it would be worthwhile doing